The dressing is right here. This is the dry dressing, and this is, the dry dressing is just an incision. And then this dressing is an open one, okay, like this. So this is the wet to dry, you would do it here. Wet to dry looks, the wound is open, and that's for infected wounds. Okay, and then this one is just stitching there. So I'm going to open my bag, put it here. And I'm going to prepare my tape. I need 4 pieces of tape for window painting. This is on the outside of the wound. And a occlusive dressing, you would tape over everything and not leave the bandage out.
An occlusive dressing?
Occlusive. Occlusive means it's closed. Oh. It's got tape over everything. This is window painting. It's just a method of taping. Okay, so 2 shorter pieces and 2 longer pieces. And oh, I forgot one other thing. Get one of those silver packets on the second shelf. Silver pack. It looks silvery like foil. That's it. That's my iodine. The doctor's order says to paint the incision with iodine. So now I'm going to take the dressing off, and the whole point of having the date and the time is if I came in and said, oh, it was just done at 12 noon, 2 hours ago, you know you don't need to do it. But if it's, say, the 28th of March, nobody's done the dressing in 3 days. So you know it's old and it needs to come off. These dressings usually are done once a day. Now, if the patient is a hairy-chested man, hopefully, usually before surgery, they shave them before they make the incision. On a woman, however, on some of these things, the pubic hair is still here, and I've seen tape all up in the pubic hair. Ow. And it's like doing a Brazilian wax. Okay, we're going to very gently. We don't want to pull out any drains, so if the patient has drains under here, you got to be very careful not to yank them out. So we pull off the dressing, put it in here, and now we inspect the wound. And it has some inflammation on it, which is normal, which is the red stuff. So before I take off my gloves, I'm going to open my iodine. Be very careful when you open this because it splatters. And we're going to paint the incision very gently. You don't want to disrupt the incision. You want it to heal. And you can use as many of these as you need to. There's 3 inside. Now we're ready to take this off. And now I'm going to open my field. You open it, peel it like a banana, and put it like there with the paper that way. Okay, same thing. Abdominal pad. And now I'm going to put on my gloves. This is the hardest part of the skill, is putting on the gloves. You just rip the outer package off, and you make sure there's no water on here, because if it gets this wet, then it contaminates your gloves. Now, when you open the package, thumb is on the left, thumb is on the right. It's like Madonna, it's a prayer, right? It's just like this. So when I open, you don't open like this, okay? You don't open like that. You have to open by these little leaflets. And on your handout, it says to do the trapdoor method. So I'm not gonna fully open this out because I don't usually have enough room. Now, right in here is where I can pick it up. Look at it. I wouldn't, if in real life, I probably wouldn't use these. It's got some kind of purple dye on it. Mm-hmm. Okay, now this is the part that's gonna fold against my skin. So I'm just gonna use my same hand. Remember, this is the left-hand glove. So, and don't dive in like this because the thumb is on that side. So you go in with your palm up, and it's sort of like putting on a Spanx. You gotta do it very slowly, and you get all kinds of wrinkles in it. And I broke it, so it's no good. So now you have to go and get another glove. So you always keep a second glove in your pocket in case you do that, because those are cheap gloves. These surgical gloves are much nicer. Look at the inside of these, how nice and thick they are. But this is a size 8, which would fit a man. These are the cheaper ones, and in your kit, that little kit there, you have another cheapy pair. All right. You open it. We're going to open it like this, take it out by the cuff. I'm going to open it like that, stuff my hand in slowly. Now, don't do this because the fingers will fall back and hit you here. So stay forward a little bit with it and wiggle, wiggle, wiggle. If you miss a finger, too bad. If you get 2 fingers like I did in this morning's group, you have to continually put on the glove and then put on the second glove and then fix it. Okay? Now I'm going to get the other one, and I can touch anywhere in here with this hand, but what I want to do is to get my 4 fingers, except for my thumb, under the cuff, and I have the thumb is out. It's called the hitchhiker thumb. Now, the whole thing is getting it past your knuckles, and here's this thumb is right here. If you have long nails, you're gonna puncture your glove. Now it rolled here. You got to prevent that from happening. Now, I already painted the iodine, so iodine is very caustic to the skin, so you got to get it off. So I'm going to just get it off like that. And now I'm going to go to Subway and make my sandwich. I want the cheese, the salami, the ham. And then on the top, boop, we're done. You can take your gloves off at this point and into this and tape. Tape barehanded because it's kind of hard to manage this kind of tape, and paper tape is also difficult to manage with gloves on. You can use your gloves if you want to. Now, if the patient is very sweaty, then you're going to have to dry the skin before you put the tape down. Now, this patient has a trach, and so if this is going to be saturated with mucus, because that's going to be like a little volcano, you would have to take that before you tape it, because the chest will be slimy with mucus. That's a nursing 2 skill. Now, I need to sign it just like the last one was signed. So I'm going to have my black pen.
I have blue.
Okay, and so it's 2 p.m.
Has to be black.
3:25. Yeah. Black is what you always chart in the hospital. You don't write on the patient. You don't sign your autograph. Okay, so that's the drive.